impact of COVID-19 pandemic on women's life. From the onset of the pandemic, it was clear that people would experience the crisis difficulty and there would be differentiated impact between women and men. A growing body of global research points to how women should a heavier socio-economic burden, experiencing a greater loss of employment than men, a far higher care burden. According to an extensive large-scale study, women from low-income households in India were disproportionately impacted by the crisis. These findings come as no surprise. It sheds light on the experiences of women during the pandemic that were very likely to happen based on what was seen in the past crisis situations. Women, on average, lost over two-thirds of their incomes during the lockdown, and as their unpaid workload increased, they were far more likely than men to report a loss of rest. The increases of household burden could also make it more difficult to women to re-enter the workforce, leading to economic consequences that will outlast the pandemic. Women tend to absorb the shock of a family's food shortages and poor food quality, with women limiting their own food, access to feminine hygiene products, and contraception was extremely limited during the lockdown and the months that followed, especially for women in rural areas, which results in unintended pregnancy. Despite the hardships witnessed, many aspiring stories of women's resilience emerge, women spreading awareness and serving as community lifelines and frontline workers. Many work difficult choices to keep household afloat, like providing family meals with fewer supplies, at times going without food themselves to ensure children were fed. Some withdraw precious savings to pay for household supplies, food, and medicine, as well as internet packages for children's continued education, where many also had